I came as the system chief operating officer. Had worked with the previous CEO, Chuck Stark, earlier in my career. And he and I had stayed in touch over the course of a number of years. Chuck was one of my original mentors, actually, and had a great opportunity. He called me to see if I might have some interest in working together again. And at that point in time in my career, I was looking for something a little bit beyond where I was at that stage in my professional development. And so he and I started talking, and one thing led to another, and then came down here to be the system COO. It was actually, I guess, a really interesting move for me from a lot of perspectives, because my first job in healthcare was actually at St. Francis Hospital. So, and I followed suit. The first time I came down to visit her, actually, I was here for, I don't know, I was in Auburn for maybe 15 minutes. They threw me in the back of a car and said, "We're going to Birmingham." I said, "For what?" They said, "We're going to the Iron Bowl." I said, "What's that?" And
what year was that? You remember the game?
Yeah, absolutely. I actually have the ticket and the picture hanging on my wall. It was the year Lawyer Tillman scored on the reverse, 86. You could say that the time I'm not at work, I am with my family. That is, I'm a self-professed, dedicated family man, and think that's probably the most important job I have right now, to be honest with you. We're only going to get to raise our children once, and so outside of working very hard all day long at work, we're working hard at home to make sure we raise our kids the right way. I think there's a big difference. Typically when you get into the administrative side of healthcare, you're not as close to the bedside. And when I did cardiac rehab, that was one of the most satisfying, gratifying, if you will, to have someone come up and hug you and say, "Hey, look, I wouldn't be here because of you. If it weren't for you, if it weren't for everything you did to help me get back in shape and change my lifestyle, and the opportunity to work very close clinically with patients." Typically, when you get into administration, you're a little further away from the bedside. Not a lot of people are running up hugging the hospital CEO saying, "I wouldn't be here if it wasn't for you today." They usually have other things they'd rather say to the hospital CEO. But that being said, I think that's probably the biggest difference, is just not being as close to the bedside. The great part about working in hospital administration, though, is you get to work with fantastic people who are so incredibly dedicated to providing that care to our patients, providing that great customer service to our patients. And so when my kids ask me what I do, I tell them I help people who help people. It's not uncommon to have interim CEOs in our industry. And that was, I think with Warren and the board, the conversation we had was, let's take our time. Let's make the right decisions for our organization, no matter what they might be. Let's make sure we take the time to do the right thing for Columbus Regional Health. It's good for the organization to be able to have some familiarity, someone who has been in the organization. And again, within our industry, it's typical for COOs to step into CEO roles. And I had been a CEO prior to coming down here as a COO. So again, it's a role that's very familiar to me, and I'm fortunate the board gave me that opportunity. I think Chuck and I, to be quite honest with you, Chuck, are similar in a lot of ways. We're both believe very passionately in putting the patient first and engaging in employees. Engaging our employees, making sure that our employees know that their voice is valued in this organization. We want them to own their work environment. I will tell you that there's a lot more similarities than differences. It is a lot of change. But what I'll tell you, Chuck, is I believe that when you have the type of change that we had with Chuck coming in as a new system CEO, we're very fortunate here in Columbus that we had someone like Larry Sanders who could be here for 30 years. Typically the tenure of a CEO in an organization is a lot shorter than 30 years. And, the average tenure for a CEO, unfortunately, these days is, more like 3 to 5 years. And hospital healthcare system CEO turnover, highest it's been in 20 years within our industry. So I think we've been very blessed in Columbus that we had someone like Larry to be here so long. I think, when you look at and you kind of normalize it, when you take away some of the retirements that were involved in that, we're probably right in line with where we should have been. The fact of the matter is, there was the change was necessary for the organization to move forward. There are great people here, but moving forward, you have to make sure that everybody There's a couple great books that talk about making sure you have the right people on the bus, and not just making sure that they're on the bus, but that they're in the right seats. Okay, and so I think that turnover aspect really is natural whenever you have a new leader. Chuck wanted to make sure he had an opportunity to build a great team, which we've done. We've had a great opportunity here to bring some really fantastic healthcare executives to this community to help run this organization going forward. There's not been any change since I've taken over. I'm very comfortable with the team that's been assembled. I will tell you, it's a strong team, and we're going to do great things. Absolutely would enjoy the opportunity to sit down and talk with Larry. Certainly has a lot of history and built Columbus Regional into what it is, today. I think Chuck furthered that, to be very honest with you, and I think we can further that even more. There's a lot of change going on in our industry right now, and so we have to make sure we keep pace with that change. And I think we're well prepared to do that. I believe we're well prepared to do that. Within the state of Georgia, we have not seen expansion of the Medicaid program. And when we didn't see, the legislature and the governor opt to expand the Medicaid program, one of the things that has occurred is we're still going to get the cuts, if you will, in disproportionate share payments because of the federal, the Healthcare Reform Act, okay, the Affordable Care Act. So we absolutely rely on disproportionate share payments, specifically at Midtown Medical Center, okay? We see a disproportionately high share of Medicaid, unfunded, and charity care patients at Midtown Medical Center. And so that's what those payments are designed to support. Well, when we as a state opted not to expand the Medicaid program, all right, we're not seeing those new enrollees come into the Medicaid program as they are in states where they have seen or they have opted to expand Medicaid. We're not seeing those new enrollees come into the system, but we're still having to deal with the cuts on the reimbursement side of the equation. That's a big challenge for this organization.
How big is that challenge in dollars a year?
It's millions of dollars. Fitch just recently put out a report where they looked at the financial health of organizations in states that have expanded Medicaid and states that haven't expanded Medicaid. And if you look at the results of, the results are very clear. States that have expanded their Medicaid program, their hospitals, particularly their safety net hospitals, are performing better financially than states that did not. And I can provide you the article if you want to see.
I'd love to see that.
Absolutely. I would say it's a competitive environment. Absolutely. We've had the opportunity, I think, to collaborate with St. Francis on some things too. So it's a competitive environment, marketplace, if you will. But it's no more or less competitive than any market that I've worked in.
So it's normal?
I would call it normal, yes. When you have two organizations the size of St. Francis and Columbus Regional, you're going to see competition. Competition is not a bad thing. At the end of the day, the patient wins in a competitive, in a marketplace that's competitive. People are trying really hard to make sure they have a quality product and a product that provides good customer service. So competition is not a bad thing. The Northside Medical Center Emergency Room really gives this community another option for emergency room services. So when you look at the number of emergency room visits in this community, north of 150,000 visits in a year. When you look at the wait times and you look at the left without being seen rates for both organizations, they're too high. And that's publicly reported data. I can show you the website to go on to get it. But to come into an emergency department and have an average length of stay of 8 to 10 hours is too long. And so there is, while there's probably, it's arguable whether there's enough capacity in the marketplace, the throughput metrics, I think, bear out that we still need a third emergency department in this community. And to be honest with you,
but you had it at Doctor's Hospital.
We did, absolutely. That decision was made prior to me starting here, Chuck. But I can tell you the logic behind it was sound, and it's a decision that I agree with. It makes sense to have emergency services more geographically dispersed in your community. It doesn't make sense to operate two emergency departments 500 yards from one another. Okay, and so when you look at the growth in North Columbus and up into southern Harris County, it makes sense for us to have emergency services on the north side of town.
Is St. Francis going to fight you on that? They are fighting.
They are fighting us on it. They have already, they opposed us in the certificate of need process, and they have also filed their appeal to the certificate of need. Well, here's what I'll tell you is, as long as it's been, it's still very fresh. And it's something that will be with me the rest of my life. I remember profound tragedy. I remember amazing healthcare workers, talented physicians, saving lives of the patients that were able to make it to hospitals. 26 individuals made it to hospitals that day. 25 of them lived. And I think that is a tremendous testimony to the healthcare workers in that region of the state of Virginia. And you talk about competitive environments. We had a competitor in that marketplace, but on that day, competition did not matter. Everybody was doing the right thing and making sure patients were well taken care of. I remember a lot of sadness, but I also remember the days that followed, the true testament to the human spirit. The students that had been shot, and Chuck, when I tell you we had students who had been shot, I'm not talking about one time. We had students in our hospital that had been shot 3, 4, 5 times. And they had such a will to survive. They had such a will to live, and they were not going to have their spirit be broken. I'd say it's a little of both, Chuck, to be honest with you. And again, we talk about the change that Chuck had over the first 2 years here. I think we're leaving out an important word. There's a lot of positive change within this organization. I will tell you that we're much different today than we were 2 years ago.
Better?
Better, absolutely better. Our staff is so engaged. When you look at the publicly reported data for quality outcomes within this organization, we've moved the needle on quality outcomes, on patient satisfaction, employee satisfaction. Our employees, from a satisfaction and engagement perspective, are rating us higher than we've ever been rated in our history as an organization. So there's been a lot of positive change in the organization. And I think we have right now is the opportunity in front of us to look at all the good things and the positive things that have occurred and continue to move those forward and advance those opportunities. The next thing for us, to be very honest with you, is to focus intently on making sure we're delivering on our strategies. Our strategic plan is something that's very important to us. Obviously, Northside Medical Center is part of that. The John B. Amos Cancer Center is part of that. We have a women's services NICU expansion that we filed a certificate of need for. We expect to hear back in September on that decision to be able to completely renovate and revamp the women's services and add additional needed NICU beds within our facility. And then our children's hospital, and what we're doing for children in this community right now is amazing, I will tell you. I am grateful for the opportunity to sit and talk with you today. I appreciate it. Thank you.